Bismillahirrahmanirrahim. Quote of the day: Ignorance is your disease, knowledge must be your cure. Assalamu alaikum. I'm Dr. Nabeela Umar. Today I'm going to present the topic of scabies and body lice under the kind supervision of Dr. Professor Saira Afzal. Learning outline: Introduction, epidemiological determinants, chain of transmission and communicability, clinical manifestations, levels of prevention, recent advances, and multiple choice questions. Learning outcome. By the end of this presentation, participants will be able to describe the epidemiological determinants, clinical features, prevention strategies. The first part of the presentation is about scabies. Introduction. Human scabies is caused by the infestation of the skin by the human itch mite, Sarcoptes scabii. The microscopic scabies mite burrows into the upper layer of the skin where it lives and lays eggs. As the mites burrow and lays eggs inside the skin, the infestation leads to relentless itching and an angry rash. According to according to World Health Organization, human scabies is a parasitic infestation caused by Sarcoptes scabii varians hominis. At least 200 million people worldwide suffer from According to WHO Health Organization, at least 200 million people worldwide suffer from scabies at one time. An estimated 5 to 50% of the children in resource-poor areas are affected by scabies. Scabies occurs worldwide but is most common in hot tropical countries and in areas of high population density. Symptoms. Symptoms of scabies usually begin 4 to 6 weeks after infestation. Symptoms. There are visible signs before symptoms begin. Symptoms of the scabies include severe itch, often worse at night, itchy lines and bumps on the fingers, wrist, arms, legs, and belt area. Inflamed bumps on the male genitalia and female breast, and larger rash in infants and small children, including on the palms, soles of the feet, ankles, and scalp. The classical sites of scabies rash are between the fingers, wrist, auxiliary areas, female breast, the umbilical area, penis and scrotum, buttocks, inside of legs, and ankles. The life cycle of scabies infestation. Number 1, the adult female deposit lays eggs in as they burrow. The eggs hatch, releasing the larvae. The larvae molt into the nymphs, and larvae and nymphs are found in the short burrows called molting pouches. Then mating occurs between male and females. Then the female then leaves the pouch and burrow next to lay the eggs. Types of scabies. Clean man scabies. This is seen in individuals who bath regularly and keep very clean. In this case, the lesions are minimal and hard to see. Itching tends to be not as intense. Infant scabies. This occurs in babies and young children and is often misdiagnosed or mistreated. Scabies will affect the whole body of the children and there will be large amount of pustules. Scabies incognito. Normally, if a strong type of treatment such as steroids are applied, then the scabies are masked and the lesions are suppressed. Norwegian scabies. This is an intense case of crusted scabies. In this case, they can be up to hundreds or thousands of mites within the lesions. This occurs commonly in immunocompromised individuals or people who are mentally challenged. They are highly contagious either by direct or indirect contact. Animal scabies. Animals are susceptible to scabies too. Domestic pets that contract scabies are liable to pass it on to the other members of the household as well. Epidemiological determinants. Every disease has a host, agent, and an environment. The agent in scabies is the Sarcoptes scabii. It is a microscopic mite which burrows into the skin and lays eggs, produces rash and itchiness in the skin. The environment where scabies is common are the tropical climate, resource poor, overcrowding, poverty, limited treatment, skin contact with infected individuals. And the host is a very young or old immunocompromised patient. Incubation period. In people who have never had scabies, it will take 4 to 6 weeks for symptoms to begin. During this period, the infested person can spread scabies. In people who have previously been infested with scabies and are exposed again, symptoms can begin within 1 to 4 days. Who is at risk? Scabies can be passed easily by an infested person to his or her household members and sexual partners. It affects people of all races and social classes. Scabies can spread easily under crowded conditions where close body and skin contact is common. Institutions such as nursing homes, extended care facilities, and prisons are often sites of scabies outbreaks. Childcare facilities are also a common site of scabies infestations. Transmission. Scabies is usually transmitted person to person through close skin contact with an infested individual. Transmission due to contact with infected personal items, for example, clothes and bed linens, is unlikely with common scabies but may be important for individuals with crusted scabies. As there is an asymptomatic period of infestation, transmission may occur before the initially infested person develops symptoms. Humans are the source of infestations. Animals do not spread human scabies. Complications of scabies infestations. The intense itching and scratching can cause skin sores. Impetigo may become complicated by deeper skin infection such as abscesses or serious invasive disease, including septicemia. In tropical settings, scabies-associated skin infection is a common risk factor for kidney disease and possibly rheumatic heart disease. Diagnosis. Based on the customary appearance and distribution of the rash and the presence of burrows, can be confirmed by identifying the mite. This can be done by removing the mite from the end of its burrow using the tip of the needle or by obtaining the skin scraping to examine under the microscope for mite eggs or mite fecal matter. Treatment. Products used to treat scabies are called scabicides. When treating adults and older children, scabicide cream is applied to all the areas of the body from the neck down to the feet and the toes. When treating infants and young children, the cream is also applied to the head and neck. The medicine should be left on the body for the recommended time before it is washed off. Clean clothes should be worn after each application. Various medication options are available. For example, permethrin cream is most commonly prescribed. Crotomyton cream, sulfur ointment, or lindane lotion may also be considered. Treatment of crusted scabies calls for an oral antiparasitic medicine, ivermectin, along with topical medication. Who should be treated for scabies? Anyone who is diagnosed with scabies as well as his or her sexual partners and other contacts who have had prolonged skin-to-skin contact with the infected person. Treatment is recommended for all the members of the same household. All persons should be treated at the same time to prevent the reinfestation. Retreatment may be necessary if itching continues more than 2 to 4 weeks after treatment, and permethrin can be used in pregnant females. WHO response. In 2017, scabies and other ectoparasite was included as neglected tropical diseases by the WHO in response to requests from member states and the recommendations of the WHO Strategic and Technical Advisory Group for NTDs. WHO 2030 global targets for scabies include countries to incorporate scabies management in the Universal Health Coverage Package of Care, and the countries to conduct MTA intervention in endemic areas, areas where prevalence is 10% or greater. Levels of prevention. Primary prevention, health education, proper cleanliness and body care, frequent change of underclothing and bed. Children who are infected should be excluded from school until disinfection. Secondary prevention, diagnosis. Whenever possible, the diagnosis of scabies should be confirmed by identifying the mite or mite eggs or fecal matter. However, a person can still be infected even if mites, eggs, or fecal matter cannot be found. Fewer than 10 to 15 mites may be present on an infested person who is otherwise healthy. Preventive measures during scabies outbreak. Mass treatment programs that use topical permethrin or oral ivermectin. There is no vaccine available for scabies. The simultaneous treatment of all the close contacts is recommended, even if they show no symptoms of infection. Families are treated all at the same time. Asymptomatic infection is relatively common. Rooms used by those with crusted scabies require thorough cleaning. Maintain a high level of suspicion if patient present with undiagnosed skin rashes. The second part of the presentation is about body lice. Lice are parasitic insects that can be found on people's head and bodies, including the pubic area. Human lice survive by feeding on human blood. Lice found on each area of the body are different from each other. There are 3 types of lice: Pediculus humanus capitis, which is the head louse; Pediculus humanus corporis, which is the body louse; Pithyrus pubis, which is the pubic louse. Only the body louse is known to spread disease. Signs and symptoms. Intense itching and rash caused by an allergic reaction to louse bites are common symptoms. Intense itching leads to scratching, which can cause sores and secondary bacterial infection of the skin. When body lice infestation is long-lasting, heavily bitten areas of the skin can become thickened and darkened, particularly in midsection of the body. Body lice are known to transmit disease. For example, epidemic typhus, trench fever, and epidemic relapsing fever. Life cycle of the body louse has 3 stages: egg, nymph, and adult. Eggs are the nits which are laid by the adult female and take about 1 week to hatch. Viable eggs are usually located within 6 mm of the skin. Nymphs, the egg hatches to release a nymph. The nymph looks like an adult body louse, but it's about the size of a pinhead. Nymphs mature after 3 molts and becomes adult about 7 days after hatching. The adult louse is about the size of a sesame seed. Females are usually larger than males and can lay up to 8 nits per day. Adult lice can live up to 30 days on a person's body. To live, adult lice needs to feed on blood several times daily. Without blood meals, the louse will die within 1 to 2 days of the host. Risk factors. Conditions of crowding and poor hygiene who do not have access to regular bathing and changes of clean clothes, such as the homeless, refugees, survivors of the war or natural disaster, body lice infestation can occur in people of all races. Transmission. Body lice are spread through direct contact with a person who has body lice or through contact with articles such as clothing, beds, bed linens, towels that have been in contact with an infested person. Diagnosis. Body lice infestation is diagnosed by finding eggs and crawling lice in seams of the clothing. Sometimes a body louse can be seen crawling or feeding on the skin. Although body lice and nits can be large enough to be seen with the naked eye, a magnifying lens may be necessary to find crawling lice or eggs. Treatment. A body lice infestation is treated by improving the personal hygiene of the infected person, including assuring a regular change of clean clothes. Clothing, bedding, and towels used by the infested person should be laundered using hot water and machine dried using the hot cycle. Sometimes the infested person also is treated with a pediculicide, a medicine that can kill lice. However, a pediculicide generally is not necessary if hygiene is maintained and items are laundered appropriately at least once a week. A pediculicide should be applied exactly as directed on the bottle or by your physician. Prevention and control. Bath regularly and change into properly laundered clothes at least once a week. Launder infected clothing at least once a week. Machine wash and dry infected clothing and bedding using the hot water laundry cycle and the high heat drying cycle. Clothing and items that are not washable can be dry cleaned or sealed in a plastic bag and stored for 2 weeks. Do not share clothing, beds, bedding, and towels used by an infested person. Fumigation or dusting with chemical insecticides sometimes is necessary to control and prevent the spread of body lice for certain diseases. Recent updates. Escalating threat of drug-resistant human scabies, current insights and future directions. Scabies is a prevalent dermatological condition with significant public health implication. The recent rise in drug-resistant scabies present new challenges for effective disease management and control. Clinical studies, in vitro investigation, and case reports show significant resistance of human scabies to permethrin. Main resistant mechanism involve genetic mutations in the mites, voltage-gated sodium channels, and enhanced activity or expression of the detoxifying enzyme glutathione S transferase. Permethrin-resistant scabies an escalating threat requiring new management strategy and updated guidelines, infection control measures, alternative treatments, and ongoing research into the new therapeutics are crucial to mitigate the impact of drug-resistant scabies. Scabies vaccine, where we stand and challenges ahead. Scabies is an itchy skin disease caused by burring mite. Globally, more than 200 million people are estimated to be affected by scabies annually. Currently, using scabicidal agents is the only approved method for treating scabies. However, resistance to commonly used agents such as permethrin and ivermectin have been observed in scabies mites. Therefore, the development of vaccine for scabies either as a preventative measure or for treatment is crucial to control such neglected diseases. This review aims to provide a comprehensive overview of the ongoing challenges regarding the currently available control measures for scabies. Using scabicidal agents is the only approved method for treating scabies until now, and resistance against commonly used agents such as permethrin and ivermectin have been observed in scabies mites. Therefore, the development of vaccine for scabies either as a preventative measure or for treatment is crucial to control such neglected diseases. Designing and developing a successful vaccine against Sarcoptes scabies mites is currently a subject of extensive research. Various studies have been conducted to develop vaccine against scabies mites, including a whole body extract vaccine, DNA vaccine, and recombinant protein vaccine. For a complex parasite like Sarcoptes scabies, immunization with a total extract of scabies mites would be advantageous over recombinant proteins. Now the multiple choice questions. MCQ number 1. Scabies infection can be complicated by the bacterial infection, which can lead to the development of skin infections, leading to more serious consequences such as septicemia, heart disease, chronic renal disease. The most rare form of scabies, which is highly contagious through direct or indirect contact, is A. Animal scabies, B. Clean man scabies, C. Infant scabies, D. Nodular scabies, or E. Norwegian scabies. The answer is E. Norwegian scabies. MCQ number 2. A 35-year-old pregnant woman presented to the medical OPD with the complaints of severe itching in the upper body, particularly between the fingers, that worsened at night for the last 4 weeks. Linear burrows and vesicles around the finger webs and wrist found on examination. Scabies has been diagnosed. Which will be the first-line treatment for scabies infected pregnant woman? A. Benzyl benzoate, C. Crotamidone, C. Lindane, D. Topical permethrin, or E. Malathion. The answer is D. Topical permethrin. MCQ number 3. An old man of 35 years of age has previously been infected with scabies and is exposed again. The symptoms will appear in this patient within A. 1 to 4 days, B. 8 to 10 days, C. 10 to 12 days, D. 12 to 14 days, or E. 14 to 16 days. The answer is A. 1 to 4 days. MCQ number 4. A daycare center in Lahore is experiencing a scabies outbreak. For the past 2 to 4 weeks, young children in daycare centers have had a more widespread rash that includes palms, soles of feet, ankles, and occasionally the scalp. Scabies is mainly spread from person to person via number A. Blood transfusion, B. Close skin contact, C. Contaminated food, D. Coughing and sneezing, or E. Mosquito bite. The answer is B. Close skin contact. MCQ number 5. In a refugee camp, a significant number of individuals are found to have lice infestations. What is the most effective treatment for controlling body lice in this population? A. Oral antihistamines, B. Topical corticosteroid, C. Benzyl benzoate lotion, D. Antibiotics, or E. Herbal remedies. The answer is C. Benzyl benzoate lotion. MCQ number 6. A female homemaid, 35 years old, had body lice infestation for the past 1 month. Which of the following disease is the body lice most likely to spread? A. Scabies, B. Filariasis, C. Yellow fever, D. Monkeypox, or E. Epidemic typhus. The answer is E. Epidemic typhus. MCQ number 7. A 45-year-old man presents with a history of severe itching that worsens at night. Examination reveals linear burrows on the wrist and between the fingers. Which diagnostic method is most definitive to confirm scabies infestation? A. Clinical history and physical examination. B. Blood culture to identify secondary infection. C. Removal of mite using a needle and microscopic examination. D. Skin biopsy to identify burrow patterns. Or E. Skin sensitivity testing. The answer is C. Removal of mite using a needle and microscopic examination. MCQ number 8. A family of four resides in a crowded urban area. The youngest child, aged 3, presents with itchy rashes on the palms, soles, and scalp. To prevent further spread of scabies within the household, what preventive measure is recommended? A. Avoid sharing food and utensils. B. Simultaneous treatment of all the family members. C. Frequent hand washing with an antiseptic soap. D. Quarantine the symptomatic child, or E. Fumigation of the home. The answer is B. Simultaneous treatment of all the family members. MCQ number 9. A health worker finds that body lice infestation is prevalent among the homeless population in a city. What is the best method to control this outbreak? A. Providing systemic antibiotics to all affected individuals. B. Regular laundering of clothes and bedding at high temperatures. C. Applying topical antihistamines to reduce itching. D. Administering oral ivermectin to the entire population. Or E. Implementing public fumigation programs. The answer is B. Regular laundering of the clothes and bedding at high temperatures. MCQ number 10. A daycare facility reports scabies outbreaks in children. What level of prevention does excluding infected children from school until disinfection represent? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Quaternary prevention. Or E. None of the above. The answer is A. Primary prevention. This is the key to the MCQs. This is the YouTube channel where all the presentation will be uploaded. Thank you for your attention.